Hello friends, welcome back to allornonelaw, and this is a rapid revising pearl microbiology. And today I'm gonna talk about what we call staph species. This is kind of a revision for USMLE appearing students, USMLE step 1 appearing students. Okay guys, so let's clearly start. So three bacteria I'm gonna talk over here, and let's see how best we can differentiate. Okay, because sometimes in USMLE they will give you what you call 3 or 4 options of staff only, and you have to differentiate based on the what you call their clinic disease presentation, their what you call their other laboratory tests, their genus features. Okay, so let's talk about the staph species, right? So we have two. One is staph aureus, the staph epidermidis. Name itself indicates, right? Yes, you're right guys. And we have staph saprophyticus. It's a kind of revision for you guys for USMLE, and really very important. Saprophyticus. Okay, let's start. Staph aureus, tell me. I'm gonna ask you and you have to tell me what's the coagulase test. Let's start with the coagulase. Let's talk about the catalase test, right? What's the catalase test for this? Tell me, is it positive or not? Staph. Cat. It's positive. Excellent. What about staph epidermidis? Positive. Right. What about what do you call saprophyticus? It's a positive, right? Tell me which are the bacteria that gives catalase negative. Strep, right? So catalase test differentiates versus staph or strep, right? So catalase positive or staph species. Okay, right. Now let's talk about the coagulase, CG coagulase test. Staph aureus, positive or negative? Positive, guys, positive. What about the staph epidermidis? Negative or positive? It's a negative, guys. Staph saprophyticus, it's a negative, guys. Okay, good. Let's talk about the hemolysis. Hemolysis. Tell me which type of hemolysis it gives. It's a beta, guys. Okay, and this is gamma, and this is gamma. Okay, right. Now let's talk about the fermentation, some important points, and then sensitivity or resistance. Tell me one feature of the staph aureus regarding the mannitol. Ferments mannitol, right? Ferments mannitol, FM. Okay. Staph epidermidis, ferments or not? And I'm not talking about fermentation. I'm talking about tell me some other important feature of staph epidermis. It's a no opsin, sensitivity or resistance. NS. Remember, it's a biofilm producer. Saprophyticus, no opsin, sensitivity or resistance. It's a resistant. Okay, right? So what are the disease presentations? Disease presentation you know very well. Staph aureus infective endocarditis, toxic shock syndrome, gastroenteritis, osteomyelitis, abscesses, right? Impetigo, pyoderma, okay? Whereas staph epidermidis, endocarditis. Why? Because of the biofilm it produces like same as what we heard about the strep viridans, right? Good. Then we have catheter, prosthetic device infections, and whereas saprophyticus, UTIs in newly sexually active females, urinary tract infection in newly sexually active females. Got it? Staph aureus, catalase, all the staphs are catalase positive. Staph aureus is coagulase positive, beta hemolytic, and ferments mannitol. Okay, and whereas staph epidermis is coagulase negative, gamma hemolytic, and novabisin sensitive, and produces a biofilm. Right, saprophyticus is a coagulase negative, gamma hemolysis, and novabisin resistance. So this differentiates from what you call epidermidis. Right? Thank you so much for watching this video. Take care.